Hello viewers. Today our topic of discussion is supracondylar humerus fracture. Now supracondylar humerus fracture is a commonly performed operation in orthopedics. Although it is a commonly performed operation, but sometimes you may feel that reduction in OT table for this fracture is difficult. So our aim of this video is to assess preoperatively the difficulties of supracondylar humerus fracture and how to deal with it. In the first part of this video, we will discuss preoperative assessment of the X-ray, and in the second part, we will discuss regarding our OT room preparation. First, we draw a schematic diagram of lateral view of elbow joint. Type 3 supracondylar humerus fracture usually reduced with the help of posterior periosteum. In high posterior type, there is a well coverage of periosteum posteriorly to hold the reduction. So, a high posterior type of fracture can be reduced easily. In low posterior types of fracture, as there is very less amount of posterior periosteum is left, so these types of fracture is very difficult to reduce. After reduction, we flex the elbow and there is some confusion whether to hold the forearm in supination or pronation. The answer is, if the distal fragment shifted medially, that means the medial periosteum is intact, so the flexed forearm should be kept in pronation. But if the posterior fragment is shifted laterally, then keep the flexed forearm in supination. So this is a preoperative X-ray, and this one is the posterior periosteum, and it is a high posterior type of fracture. So preoperatively we can determine that this is a stable type of fracture. Now my trick for the fracture is position of the patient. In case of small children, always keep the baby at an angulation like this, so there is no difficulty to see the C-arm. Second one is, after anesthesia, always give traction for 5 minutes. Don't in a hurry, always wait for 5 minutes in traction. It makes your task easy. Now look the C-arm image. The impaction is almost absent here. Here I want to add my third trick, that never rotate the elbow to see the lateral view. Always rotate the C-arm. Now fix the fracture and always leave the OT room after assessment of vascular status. So this is the first part of my video. In the second part, we will discuss step by step only the operative procedures. Message is, always pre-operatively assess the difficulties by seeing the pre-operative X-rays. Predetermine whether you put the flexed forearm in supination or in pronation. Always give 5 minutes of traction under anesthesia. Never rotate the limb to see lateral view. Always rotate the C-arm. That's all for this video. Please like and subscribe my YouTube channel. Thank you.